Let me first come to the first thing, what an abscess and its management. Let me come to the definition of an abscess first. Abscess is essentially a collection of pus lined by granulation tissue or pyogenic membrane. So obviously, if you look at an abscess, we'll have to consider what would be the classification of abscesses. Abscesses could be intracavitary, in any cavity for that matter, pelvic abscesses, ambicular abscesses, empyema of the liver, of the lung over there, and followed by that you can also have brain abscesses. And these intracavitary abscesses will be covered by Manoj, so it will be like a complete session for you to understand everything about abscesses. Second is extracavity, which you commonly see in our general practice, abscesses. And I want to explain to you these abscesses, extracavitary abscesses, which will be very useful to you in understanding what an abscess looks like, what kind of abscess you can tackle in your clinical practice, in your general practice, in your clinic, and what needs to be sent across to a hospital like ours over here. A pathological type of classification. Essentially, all the abscess can be classified into either a pyogenic abscess, a pyamic abscess, a cold abscess, or a sterile abscess. So if you look at pyogenic abscess, it's a single solitary collection of pus with no primary focus anywhere. So if I get a furuncle, that is, if I get a folliculitis, that's a pyogenic abscess. On the other hand, a pyamic abscess is such where there is a septic focus somewhere, like a bronchiectasis, like a lung abscess, like a sigmoid sinus in the brain, an abscess, infection, thrombosis, and from there septic emboli are thrown to various parts of the body, and wherever they settle down, they form abscesses. Always remember, I always tell people, I will never promise a good scar to an abscess patient. I never do that. Even if it's a film actor, actress, you tell them later on if you want a revision of scar, I'll send it somewhere else. But I can never promise you a good scar at any time. This is a very simplified version. Some few points which I wanted to know about is palmar abscesses. Now when you get a palmar abscess, we have 5 palmar spaces in the hand. 3 on the ventral surface, palmar surface, 2 on the dorsal surface. The dorsal surface is subcutaneous, subeponeurotic. The ventral surface is thenar eminence, hypothenar abscess, and the space of perona, which comes here. The space under the palmaris longus muscle. When there is an abscess, invariably, simplest way to understand why they get an abscess is that some kind of a thorn goes in the hand. Abscess can come in there. I always tell them a very simple way to understand: local, regional, and general. For example, if I get an injury on this side, fractures, infection gets infected, it can go up the peroneal space, come to the thenar eminence. The thorn is a direct injury. This is a local extension. Or if the person has got septicemia, multiple pyamic abscess, one of the abscess can land up here also. So local, focal, general would be easy way to remember why you get palmar abscess. The principal thing about this palmar abscess is that you will never see any swelling on this side. The swelling is always on this side. For the simple reason that this swelling, the tissue over is a loose tissue, whereas this tissue is very tense and the palmar fascia is very tense. So always remember, swelling will come on this side, does not mean the abscess is here. The always abscess comes up here. Thenar and hypothenar. Drainage is very simple, I told you. Functional fascia means they always get a frog hand because the parts can't be moved. And the drainage is very simple. Do not create new lines on his hand. Whatever lines are available on his hand, this is for the thenar eminence, this is for the hypothenar eminence. If I've got a space of perona, it goes along this line, but it goes from this side and goes down here. Okay? One thing which I want to tell you about is the Hilton's method of abscess drainage. When do we do Hilton's method of abscess drainage? John Hilton, also called as anatomical John, had described this process that Hilton's abscess, any abscesses which are deep to the deep fascia in relation to a neurovascular bundle has to be drained under general anesthesia with the incision in the skin to be taken with a knife, that of the deep fascia by a sinus forceps, an adequate incision, dependent drainage and total evacuation of the abscess cavity would be the definition of what I am telling you is deep abscesses, Hilton's method. Incidentally, for our own Make in India, this method was exactly described in the same by Sushruth years ago much before Hilton has described.